Now it's time for Real Health Talks news and views with cancer nutritionist and neurodevelopment specialist Craig Stelflew.
In the category of lifestyle, the God factor. A recent study published in the Journal of Affective Disorder found that people with moderate to high level of belief in God fare significantly better in the short-term psychiatric treatment than those without faith, regardless of their religious affiliation. Faith improved psychological well-being and decreased depression and intention to self-harm. People with no or only slight belief in God were twice as likely to not respond to treatments as patients with higher levels of belief. Faith. Got some? In the category of food nutrition, menopausal women who eat high-sugar, high-fat diets are 23% more likely to experience hot flashes and night sweat. Over a 9-year study, women who ate fruit and followed the Mediterranean diet reported fewer hot flashes after accounting for other lifestyle habits. But vegetables, meat, and dairy were not associated with either a higher or lower chance of having menopausal symptoms. Low-fat, high-fiber diets help stabilize estrogen levels and ease hot flashes and night sweats. Eating a Mediterranean-style diet can also help keep blood sugar within optimum ranges, which can lower a woman's chance of menopausal symptoms. In the category of medical madness, so the next flu epidemic has been thrown out there like bait for people to panic and demand yet another vaccine. But the new H7N9 bird flu does not leap from human to human. According to the Lancet and WHO, it has been isolated to the bird markets of China and jumps from chicken to man. This H7N9 strain has infected 109 people in China since March, and the WHO has been quick to warn that this strain is, quote, one of the most lethal, unquote, flu viruses ever. The University of Hong Kong finds that chicken and poultry markets were a source of human infections, meaning that controlling the disease in these places and in these birds should be a priority. Did you know that one of the best natural flu preventatives is astragalus? It is definitely not the flu vaccine. In the category of vitamins and supplements, iodine deficiency patch test. Buy some tincture of iodine. It should be orange colored, not the clear solution. At night before bed, paint a 3-inch by 3-inch patch of iodine onto the underside of the forearm. In the morning, if there is no color left at all, you are definitely iodine deficient. If there is still a bright yellow-orange patch left the next evening, you are at optimal levels. Any color from grayish to pale yellow indicates suboptimal levels of iodine in your body. The Japanese consume about 12 milligrams of iodine a day. In my opinion, this will keep you at a healthy level if you're not already deficient. You will need more for the short term to catch up if you are deficient. 50 milligrams a day can do this in 30 to 60 days. Stop taking iodine if you have heart palpitations show up in the night or if you acquire garlic breath without eating garlic. And finally, in the Real Health Talk news and views trivia, sunshine trivia. Vitamin D regulates the activity of some 160 genes related to how the immune system fights diseases. More specifically, cancer, heart disease, autoimmune disorders, and colds and flu. Thank you for listening.
Thank you for joining us. You have been listening to Real Health Talks News and Views, featured every weekday on El Shaddai Radio. Join us for Real Health Talks weekly broadcast every Tuesday night at 7 p.m. Phoenix time.
If I could reach the stars